Hi, welcome to IRR TV. I'm Bakam Mulawa, and with me today I'm with one of the research analysts from the institution, Tawanda Makombo. So, Tawanda, why did the institute find it fit to conduct this particular research?
The institute saw it fit to conduct this research because we wanted to evaluate the effectiveness of the health sector in South Africa.
What were the key findings of the report?
Our research was focusing on three things. Our first facts, the first thing is it was on expenditure. The second thing, resources. Then the third thing, it was indicators of success in the health sector. So our main findings on expenditure was that a public health sector as a proportion of total expenditure on health in South Africa has been increasing since 1994, and at the same time, private health expenditure has been decreasing. Then when it comes to health expenditure per capita, South Africa's health expenditure per capita is comparable to that one of Brazil and Turkey, even though it's actually less than that one of other developed countries like UK and the US. Then when it comes to resources, our main finding was that the healthcare sector professionals have increased across the board. If you look at the number of general practitioners in South Africa, they've increased since the year 2000 by about 80%, and the number of professional nurses in South Africa has increased by about 50% during the same period. Then also in South Africa, we have a total of about 4,000 public and private hospitals and clinics, and about a third of these hospitals are found in the private sector, and just under a fifth of the total clinics are found also in the private sector. Then we also found out that a quarter of total beds in South Africa are also found in the private sector. Then when it comes to indicators of success, we saw that our public health system has been doing quite well over the past over the past years. For example, if you look on HIV and AIDS awareness and campaigns in South Africa, they've been improving for the past 7 years. Then infant mortality rate has been decreasing, stillbirth rate has been decreasing, and also life expectancy has been improving since President Thabo Mbeki era. Even though our public health system has been effective to some extent, but we feel like more needs to be done, because if you look at the diabetes death rate in South Africa, it's high compared to other countries like Botswana and Nigeria. Then asthma death rate in South Africa is also high compared to other countries like China and Chile.
What does the institute recommend?
The Institute of Race Relations recommends the use of healthcare vouchers. We think that will help to improve access to healthcare.